Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to the Acupuncture Outsider. This is Richard Hazel, and this week I'm going to talk about a couple of the tough cases that I'm working on right now that I have not resolved. So you can hear how I'm kind of going through, like, methodically trying to figure out what's going on. And I wanted to give some updates on things coming up. I just have to create a Zoom account. I want to have a Zoom account to be able to record Zoom meetings because I'm going to open up the subscription on Podia for what I would consider an affordable coaching platform. So it's not one-on-one, which, I know if I'm doing one-on-one, then obviously I have to charge more for the time. Whereas if I'm doing a Zoom meeting and it's maybe 3-5 people, then obviously it's going to be affordable to almost anybody, in any part of the world, based on your economy and exchange rate, should be affordable. And in the membership, I'm including 2 of my courses that you normally would pay for, which is the Core Essentials and the Manual Muscle Testing courses. So that's kind of geared toward people who are just getting started with orthopedic acupuncture, trying to understand the methodology, understand how you choose what to treat and, why you're doing it. So I want everyone, if you're going to be in the mentorship, then you have the Core Essentials and the Manual Muscle Test, so that when, if I point you to something like that, then you can review it. The Core Essentials has a lot of anatomy review of things like upper cross, lower cross, myofascial slings, tonic, phasic, rehab strategies from Dr. Yanda, just a lot of things that I think everybody needs to know to get the best results. Well, because getting the best results requires the best assessment. If you get the right assessment, no matter how you approach it, you will have some level of success. Even if you couldn't use acupuncture, if you understand the problem, you can find a way to apply manual muscle techniques or stretching or massage gun, depending on the issue. So we're going to do the mentorship membership. It's going to be $30 US a month, and you can drop out at any time. There's no major commitment, no you have to pay for 6 months or something like that. Nothing like that. I want it to be affordable. I kind of wanted to create what I wanted to have when I was new to, treating patients and having challenges and trying to figure things out. It probably worked in my to my advantage that I had to figure it out myself, because that was why I had to sort of dive into the sort of dry reading about orthopedic stuff. It helped me to really fully grasp concepts and really, have that ready at any time. I don't have to just constantly look something up. But I want people who are new to be able to get excellent results from the very beginning, because you have to survive long enough in your practice to know these things without having to think about it. And that may take some time. I feel like it probably takes a few years of doing orthopedic acupuncture before you really start to have a good rhythm and just know where you want to go and know what you want to do and whatever the new challenge is. And if it didn't respond, then what do you do next, or what do you look for? That takes time. So I want to be there to help people who are having challenges. And we all have tough cases. We all have challenging cases where we're not getting much help from the medical experts on either the etiology or the best approach for this person's pain, because sometimes we don't even agree on what the actual etiology of their problem is. So yeah, look out for that. I am just starting to talk with the people at China Books to arrange something in Sydney next year, probably in March. So be on the lookout for that information. And I just spoke with somebody to possibly do something in Montreal maybe next year. So that would be exciting. I would teach in English, but I'm definitely looking forward to having conversations with the French-speaking people who attend. And I am in Amsterdam in September with Jenny Nieders and Josh Margolis. You guys really should consider making it to Amsterdam in September. I think it's going to be excellent. I think we've already talked together about what we want to teach, so that there's no big overlap, and that it's cohesive, and that the things that we're talking about all kind of make sense together, even though they're different topics. And there's going to be a lot of cool, interesting assessment and treatment techniques. And I think Josh is definitely bringing some stuff that maybe nobody there will have seen before. And I'm changing around my hip and headache material to add new material and talk a bit more about nerve entrapment syndromes for the hip. So I'm bringing new material and trying to streamline assessment to get accurate assessment of what's going on and not have to take a lot of time with that. And Jenny's going to bring awesome stuff, and that she's the team acupuncturist for the San Francisco 49ers. So if your dream is to work on pro athletes, you want to meet Jenny and make that connection. So I think it's going to be really awesome. You guys should look into it. Come to Amsterdam in September. You have nothing better to do. September is often a slow month for people. August and September can be kind of a slow month for patients. So consider that, and maybe don't beat yourself up when it gets slow, and just admit that it's going to be slow, and take a week and come to Amsterdam and meet lots of really cool people. Okay, so we're doing that, and trying to think what else is on the schedule. I have some new videos I'm going to be shooting hopefully this coming week for the Motor Point Guide. One of those is going to be the plantar nerve trunk. I think I'm doing orbicularis oris for this shoot as well, on someone's request. So there'll be some new stuff coming soon to the Motor Point Guide. What else? I guess those are the only announcements I wanted to make. So just be on the lookout for when I open up the membership in case you're interested. We'll do Zoom meetings. I'll probably start out as a once a month Zoom meeting, but realizing that there are people in completely different time zones, I may end up doing 2 per month if there's enough interest. For instance, the people who are in Australia or maybe even in Europe may prefer a different time and day for a Zoom meeting. So, based on feedback and interest, I'm definitely willing to do that, to kind of split it up and have one where I do it very early in the morning for myself and one maybe late in the evening for myself so that it's morning in Australia. Okay, so all of that out of the way, my tough cases. I have a case of blepharospasm. It's her left eye. And basically the eye just goes in, just blinks and is very light sensitive. She has to wear dark sunglasses. It started out kind of as just an occasional sort of twitch for the eye, and it became almost nonstop. I mean, when she's having a really bad day, it's just spasming, and it causes a lot of headache, especially in the forehead, right above the eye that spasms. So she is the friend of one of my patients that I had already been treating, and her friend, they're both retired medical professionals, so we could talk pretty, wonkily about nerves and things. So she mentioned her friend had these blepharospasms, and she said, "What do you think?" And I said, I haven't studied that, but it, it's like a facial nerve thing, so I would recommend, the pathways of the facial nerve where things could get impinged might be somewhere at the occiput, near the where the SCM attaches, and then maybe somewhere in the jaw, like try, in the masseter, try in, the temple area right behind the eye. Perhaps there's a branch there that she'll find some tenderness that she could massage. Maybe there's a muscular compression of the facial, one of the branches of the facial nerve that is irritating the facial nerve and causing these spasms. And I, when I finally saw the patient, I did find that she was also having spasms in that sort of, I guess it's like I want to say mandibular. I don't know. I don't remember that middle branch, but the one that goes toward the nose and the upper lip area, that was also spasming. So it was the branch that goes up to the eye, and then the one to, toward the nose. So I decided to see if electric stimulation might help. And I originally started out thinking maybe there's an entrapment at the occiput, SCM, maybe right in front of the ear, something like that. And then I switched to only stimulating in the masseter and that sort of Tai Yang area indentation behind the eye. That seemed to get both of those get good stimulation of the facial nerve without too much discomfort or muscular contractions. So, and she's like pretty needle sensitive. So I just try to keep it to what she can tolerate. So I put those two little tiny needles in, and then I hook up the electric stim for about 10 minutes. And it seems to be helping. She still has the spasms, but she has many good days, she calls them. She said, I had 2 or 3 good days, and then the spasm came back, and and that was a really bad day, and then she gets these headaches right above the eyebrow. So twice she's come in on really bad days with her dark glasses on, and she's in a lot of pain from that headache, and the electric stim alone has made the headache go away. And then usually the spasms don't subside too much in the treatment. She still have some, but then apparently the following, day or 2 or 3 are much better, less spasms. So I can't cure her, but I've been able to give her some palliative relief, which is a nice step, but it would be great to understand it better. And apparently it's one of those issues that so few people have that they really don't know much about it. They have theories about how the spasm is being generated, but not how it is being, like, what's the etiology of that? Like, what is really going on that caused it? So that makes it tricky for me. And I'm still, looking into it, trying to figure out what else could I try that might get longer lasting results. For instance, I've been considering, instead of treating just those two areas, but maybe try to get the orbicularis oculi muscle, maybe just, right on the outer part of the eyebrow. I think I tried that the very first time I saw her, and it didn't seem to make any big difference. But that's one of the things I'm thinking about. Um, and maybe, one of those little muscles next to the nares of the nose sort of area, like for a stroke patient. Um, I don't know. I'm just trying to think through, like, what else could I try to see if I get longer lasting results. So that's a tough case, and part of that has to do with um, the it being a diagnosis that's not well understood by even the experts. So that's tricky. And then I have a patient who has, well, I'll tell you the symptoms, and um, then I'll tell you what I think. She's on a lot of pain medications, including opioids, because after she had a hip injury, I think she was just getting out of the car, but like her hip popped, and then she had horrible, horrible hip pain, crippling hip pain, and then um, she went to the doctor, and they tried nerve blocks, they tried a stimulator. I think it was a spinal cord stimulator. She thinks it was in the low back. Um, but she doesn't have good memory of where the stimulator was. I think it was in her low back. Um, and she has sharp shooting pain sometimes in the rectum, and then she gets like spasms. Her constant spasm is sort of rectal spasms. Um, like, and apparently sometimes it's just off the chart horrible pain. Most of the time, it just feels like muscle pulsing, and if she lies flat on her back, then she gets pressure in her abdomen, and this contractions get a lot more uncomfortable. She can't find good places like to sit or whatever. If she stands, she'll get temporary relief until she's standing for too long, and then it comes back. But when she first stands up, it goes away. But then she has a lot of hip pain. That's stuff that I'm working on as well, because she had just so much tension in her hip muscles. And I've been working to basically feeling like if I can get her hip better, then maybe some of this will go away, because I think it's nerve entrapment. Um, I've assumed it was pudendal nerve entrapment. She was sent to me by a urologist who had a patient of mine who did very well for a pudendal nerve entrapment, and so she sent me this case. And this is a really tough case. So I've done a lot of dry needling for the muscles that could be entrapping the pudendal nerve, primarily the piriformis, the obturator internus. I've worked on the gluteus maximus, because anything that can attach to the sacrotuberous ligament and put pressure on the pathway of the pudendal nerve, that's been on my mind. I've at one point she had a lot of on the it's all one sided, by the way, it's all right sided, and she had a lot of pain just on light pressure in the abdominal muscles, like transverse abs, external, internal obliques, something like that. So I was treating those and thinking possibly maybe this is a different kind of nerve entrapment, maybe like it's ilioinguinal nerve entrapment, because she does get some numbness on the inner upper thigh area into the sort of groin area. So I thought maybe that's what it is. Maybe it's a combination of nerve entrapments like pudendal and ilioinguinal. So I try different things. One One thing I can say is that doing electric stimulation of the S2, S3, and sometimes even S4 sacral foramina has given her temporary complete relief. So if I do like 10 to 15 minutes on those sacral foramens with the needles all the way, as deep as I can go and try to not be uncomfortable, and just 1 hertz of electric stim for 10 to 15 minutes, and her all of her symptoms, all of the sort of rectal stuff goes away. And then one time that lasted for, I don't know, 20 minutes or so. On her way home, it started to come back. But one time it only lasted for like 5 minutes. So it's been really kind of hit or miss. But my conclusion is I'm on the right track. I think it is a pudendal nerve entrapment, though that is not necessarily a diagnosis that she has been given. I basically have to treat based on what I think. So it's tricky. I wish that I had the exact diagnosis, so I wouldn't spend time on things that weren't going to work. But and I don't like to treat like 2 or 3 different diagnoses at one time, and then you don't know what helped if it does help, especially if it's like temporary help. You don't want to have to do those like 3 different things that that didn't help, if you don't need to. So I'm working on it. Her hip pain is getting better. Her mobility is getting better. Pain down the front of her leg is somewhat better. Still numb on the inner adductor area, and still has really, really bad days of what I think is the pudendal nerve causing contractions and shooting pains. And it is one-sided. And I've tried to press all along the pathway of where the pudendal nerve could be entrapped and cannot find a sensitivity that tips me off. She's pretty large, overweight, so it makes it even harder sometimes because in order to push even just to the piriformis, I'm pushing pretty deep just to palpate the piriformis. It makes it a little trickier. But I haven't given up. I think there are other things that I'm going to try. I think the next thing I'm going to try is, I was reading about epidurals for labor, and sometimes they'll do an injection for the pudendal nerve below the piriformis right before it goes into the lesser trochanter, when it comes out of the after it comes out of the greater the greater sciatic foramen before it goes into the lesser sciatic foramen, right below the piriformis. They do a nerve block. So what I was thinking was I could use electric stimulation in that area. Just try really, carefully, just to go right below the piriformis, but not too deep. I don't want to hit the nerve or cause discomfort from the electric stim. But I think if I get close with some stim, it'll cross over. It'll reach into that area to possibly neuromodulate the sensory aspects of the pudendal nerve. We'll see. And I guess there's a motor function there too. It's causing those spasms. So I'm going to give it a try and see if it's comfortable. If it's uncomfortable with just, a few seconds of stim, then we're definitely not doing it. But if she can tolerate it's not uncomfortable, I would just want to see if I get a longer lasting neuromodulatory effect than just treating the S2, 3, and sometimes 4. So there's my tough case. And what else? And yes, I've been trying from the front too. I've been working on the psoas. I can't really reach her iliacus well, but hoping that the motor point for the psoas is kind of overlapping that iliacus tendon, so getting some release in the iliacus. But there is always a possibility that iliacus has got some, hitting a different nerve, that like a genitofemoral or something, that could be affected. It's tricky. It's very tricky. But anyway, the psoas motor point does give her some relief, so there is something pointing to a different nerve entrapment other than pudendal. Okay, so if nothing else, this is making me dive in really deep on nerve entrapments for groin pain and pelvic pain and all these sort of urogenital symptoms. So those are my tough cases. I guess that's it for this week. Sorry if I'm not giving you lots of treatment tips for things, but I think it's good to be transparent that I get stumped on stuff, and I don't give up. If the patient's willing to keep working with me, I'm going to keep reading and trying to figure out new approaches, find something that will give longer lasting, better relief. And then I also said, if I am not able to help you, I would very much like to speak with the doctor who referred you and tell her what I think is going on in case there's a medical intervention that is necessary and possible that could give permanent relief. So we'll see where it goes. Anyway, I hope you have a great week, and be on the lookout for the Podia announcements. And that would be, if you're already signed up on Podia, you'll get an email, and if you're not, then you'll see something on Facebook and Instagram. Okay, take care.